Hello, I'm Varun, one of the authors of the paper. Norway has an estimated 150,000 COPD patients, all over the age of 40. Many of these patients are under or misdiagnosed and are not receiving proper treatment. In Norway, as in many other countries, GPs are the first contact for patients with COPD and manage the stable disease. We developed a decision support tool, which we call the COPD calculator, to find out if this could help increase both diagnostic accuracy and help the GPs manage patients according to the GOLD 2019 guidelines. GPs would have to enter physical characteristics of the patients and the spirometric values in the calculator. If it was likely that the patient had COPD, the system would suggest the diagnosis, group the patient according to the GOLD ABCD guideline classification, provide treatment suggestions based on the group, and suggest non-pharmacological treatments. If it was unlikely the patient had COPD, the system would suggest considering other diagnoses. We recruited 36 GPs and randomized them equally into a control and intervention group. They were asked to include either newly diagnosed or follow-up patients with COPD. The GPs in the intervention group used our COPD calculator, while the control group did not. At the end of each consult, patients in both groups answered a set of questions related to the clinic visit. We had 149 patients, 88 in the intervention, 61 in the control group. All the patients in the intervention group were rightly diagnosed as having COPD, while only 77% were rightly diagnosed in the control group. The remaining patients who were misdiagnosed in the control group were included even though their spirometry readings were normal or had a restrictive pattern. Nearly 1/3 of the patients did not receive appropriate treatment according to the GOLD guidelines. There were no differences between the groups here when the calculator was used at a single visit only. This was an exception when it came to the prescription of short-acting muscarinic antagonists. GPs in intervention group, however, significantly more frequently advised smoking cessation and offered vaccination. Our study, in short, showed the COPD calculator improved diagnostic accuracy and non-pharmacological management, but did not have a strong impact on drug prescription when used at a single clinic visit.